Okay, this is your unit number 9, information, education, and communication for health. Okay, so let's see the concept of health. So the concept of the health, okay, the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay, so all of you have understand that you have guys have been learning the concept of health, the definition of the health given by World Health Organization. It is a state of the complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So now coming to the concept of the health education. Okay, in this unit number 9 we are mainly discuss we are going to deal mainly on health education with the individual, health education with the community, and health education with the patient family. Okay, so and then what are the mass media communication that we had, okay, for health education. So let's see the concept of the health education. Health education, it is a term which is commonly used and we referred, okay, which is being done by the health professionals. Okay, so all of you have done this health education, right? So it is a term we commonly use. Okay, this is an instrument of changing attitudes and behavioral patterns of It is an instrument of changing attitudes and behavioral patterns of people towards attaining better health status through adoption of health innovation and practices. Okay, so you do this health education. Why are you doing this? Okay, to bring a change in the people's attitude towards their health. Okay, to adopt a better practices. Okay, to promote their health. So it is a translation of what is known about health into a desirable individual and community behavior patterns by means of an educational process. Okay, so you do this health education to those community, to the people who are in need. Okay, whatever you know about this medical information, you pass it on to the needy people, that is the individual, the community. Okay, by means of educational process, like your like example, that is your health education. Okay, these are the concept of health education. So now that the definition of health education is nothing but the translation. Okay, it is the translation of what is known to you about health into a desirable individuals and community behavioral patterns by means of educational process. Okay, you know something about your medical. Okay, you know about this, you are a medical profession, so you know about the concept of the health, what are the disease conditions, what are the infirmity. So you are going to translate what is known about health into the people who are in need, your individual, your community people. Okay, through the process, through the educational process. Okay, so coming to the principles of health education, so what are some of the points that you have to follow while giving this health education? First is credibility. Okay, your content should be trustworthy or believable. Okay, it is the degree to which the message to be communicated is perceived as trustworthy by the receiver. Good health education is based on fact, which has to be consistent, compatible with scientific knowledge. Okay, you cannot just give whatever you know, okay, about so maybe let's say a topic, you cannot just give. Okay, your content should be trustworthy. Okay, it should be believable. Okay, it should be it should be compatible with the modern scientific knowledge. Okay, so that the first point is credibility. Okay, the degree, the quality of being trustworthy and believable. Okay, and number 2 point is interest. It is a psychological principle that people are unlikely to listen to those things which are not to their interest, and the educator must find out the real health needs of the people. Okay, so if you have interest, suppose I am the health educator, so my roles and responsibility first before giving this health education is I should know what is the point of interest. Okay, I should know what is the point of interest for the group of the people, for the community, or for the patient. Okay, so so if we have that interest, if the patient parties, if the community, if the group of people have that interest on that topic, so they are going to listen it very properly. Okay, so I'm using, this is a psychological principle. Okay, interest should be there, we should find out the needs, and then we should find out the needs of the people, okay, and then they are likely to listen to those things which we have given. All right, so the first point of the principles of health education is credibility. Okay, and second point is interest, and then Coming to the third point, participation. Okay, so it is based on a psychological principle of active learning. Also, if you actively participate in that program, in that health education, you are going to learn something. Okay, so we aimed health education should be aimed at encouraging people to work actively with health workers in identifying their own health problems, developing solution and plans to work them off. Okay, so active participation is important to learn it. Okay, to encourage people to work with their health and to bring a change in their health. So now coming to the next point, motivation. So this is a fundamental desire, okay, in every person to learn, okay. In every person have this fundamental desire to learn. So awakening, our responsibility is we have to awake the desire to learn. That is known as your motivation, okay. So there are primary motives. There are two motives, okay, primary motives and secondary motives. So primary motives are your driving forces initiating people into action. Inborn motives such as hunger, survival. You want to learn it from your side, okay. So for example, you are hungry, okay, you do it for survival. So these are the primary motives, okay, your initiating driving forces. And secondary motives are created by the outside force, okay. If I want to, suppose I do a health education, maybe a quiz, okay, I conduct a quiz program, then I have chosen some of the participant, okay, the participant uh, have participated in this program. So what I did is, being a program organizer, I praised them with some awards, okay, with some rewards, with some gifts, okay. So this is a secondary motives, okay. This is created by outside forces, like example, praise, compliment, rewards, give, okay. So motivation are contagious. Once you are motivated, you are going to motivate your whole group. So that is why motivation is contagious, okay. So till now we have learned about the principles of health education. First is your credibility. The content should be trustworthy, it should be up to the mark, okay, compatible with the scientific knowledge. And then the second point is your interest, okay, interest from your patient side. We should see the area of interest. And then your third point was participation, okay. Active participation is required from the patient party, from the health educate, from the one who is going to attend this program. Motivation, okay, we have to awake the motivation, we have to give them the motivation, especially from our side we can do this secondary motivation, okay. All right, so coming to the comprehension, okay, we know English, okay. Suppose let's say I am a Manipuri, but I cannot give this health education in Manipuri, right, in a Khmer patient. So I have to give a health education in the language where they know. Okay, either I can give in Assamese or either I can give in Manipuri. Okay, so comprehension is nothing but the levels of understanding of their language. It is essential to know the level of understanding, education, and literacy of the people to whom the teaching is directed. Okay, I cannot just say ki I cannot take a class on ANM with English. Okay, all right. So the ANM, they has to be taken classes. Each and every word of the English has to be translated in us on their own local languages. Okay, they are not into a like we should. It's our responsibility to know their understanding level and to know their literacy level. Okay, even in higher education also, I cannot just give this higher education and talk things in English. Okay, it should be either in the language where they could understand, either Khmer or either Hindi. All right. So the language should always be the one to which the group can understand. All right. So the next point of principles of health education is your reinforcement. Okay. Few people can learn all in one single period. Repetition and intervals is necessary. If there is no reinforcement, there is possibility of group going back to the pre-awareness stage. Okay. Reinforcement is when you like repetition. Okay. When you do not repeat the classes, suppose if you learn a topic in first year. Okay. So if you do not keep on revising yourself, repeating yourself, you tend to forget it. Like the same thing happens. Okay, so like I gave a health education, okay, and then maybe the patient might take maybe 30% of the content may be grasped by them, but if I do not repeat them, okay, if I don't do this reinforcement, there is a high chance, okay, there is a possibility of going back to the pre-awareness stage. Okay, so reinforcement, okay, repetition, and then coming back and doing again health education, like okay, time to time, it is important. That is your reinforcement. So now the next objective is learning by doing. Okay, learning is an action process and learning takes place by doing. The levels of understanding is different. Okay, so learning by doing is an example, is an important principle of health education. You learned it by doing. Okay, even in your demonstration also, we do the demonstration, and then after the demonstration is being taught to you, you have done this return demonstration. You are doing it, you are learning it by doing yourself. with hands-on experience. So that is why even while I giving health education, I might demonstrate something. So the patient may get the group can do this re-demonstration. Okay, I can ask them some question also. So they are learning by doing. So this is an important principle of health education. Now, known to the unknown. Okay, so we should always start. Okay, these are all the principles of teaching and learning also. Start from known to the unknown. All right, and then we should proceed to the knowledge which is being accumulated. And setting an example while giving this always give an example. Okay, for a better understanding. And then the next principle is push-win relation. Sharing information, ideas, and feelings happen when two people when they have a good relation. Okay, so only when I have a good relation with all of you. The next one is push-win relation. Okay, I can share my information only when we have only when we have a good rapport. Okay, so when we have a good rapport, we can share ideas and feeling. Okay, so I should have create a good rapport with the group and with the community when we have to do a health education. Okay, and next is feedback. Okay, for effective communication, feedback is a very important. After your health is being provided, take feedback whether they understood or not, or whether they want any repetition and what do they understand from your health education. And then leaders. Okay, leaders are it's you. Okay, you are the change of agent. Okay, you are going to change your patient scenario. Okay, the community people's ideas and needs. Okay, you are the one who is responsible to change the concept, this concept that they have in towards their health. Okay, so these are some of the principles of health. Now, let's just go back and rewind. What are the principles? Now you tell me what are some of the principles of health education. Whatever you remembered, some of the principles of health education are
Credibility, participation,
yes,
motivation,
yes, known to unknown, good human relationship, feedback. Okay, Mandi, very good. Okay, I appreciate that. So now let's go to the another. Okay, so how are we going to plan this health education? Okay, let's see. We have some of the things that we have to do. Okay, first thing is assessment, like we always do in nursing management. Also, first thing assessment. So what is assessment? Assessment is a process of gathering data systematically to identify the problems of the patient and family. Okay, so first thing is assessment. We have to gather data systematically in order to identify the problems. How are we identify the problems? We have to ask them. We have to gather data, and then we have to identify what is the problems of the patient. Then select the area to be assessed. Okay, and then after this, after the cell or after the area has been assessed, we have to gather data. It can be either in the form of observation. We can do observation. We can interview the patient and the community. We can review this patient reports from the hospital or from any community CHC, a review of literature. And now after this, we have to categorize them. Okay, we have to shortlist them. We have to cluster them. We have to cluster them all the data, the observation review. We have to carefully validate them problem areas. Okay, with the similar. After this, we have to specify what are the things that they require. Okay, I should be related to the nursing diagnosis and diagnose that knowledge deficit. All right. So, an assessment. What are we going to do? Okay, we have to gather the data to identify the problem. So, for this, what we can do, we can assess the area. We can collect the data through observation, interviews, review of patient literature, and then we have to categorize and shortlist it. After this, we have to validate it. Okay, and then we have to diagnose what is the patient problem. All right. Now coming to the assessment. Okay, planning. First thing is assessment. How are you going to plan health education? First thing is you are going to assess. You are going to do an assessment. Okay, in assessment you have to look out for your area, and then you have to gather data. You have to shortlist it, validate it, and then you have to diagnose it. All right. In assessment, your responsibility is done. Now coming to your planning. Okay, so planning involves many steps, which include okay prioritization. Now you have done this nursing diagnosis. You have diagnosed what are the patient problems. Now you find out so many problems of the patient. And after this, you have to prioritize the learning needs. Okay, teaching about the chronic illness take place in hospital setting must be followed up. Okay, learning overloads occur in outpatient settings. Are given many instructions related to self-care and prevention. This is an example, okay? You have to prioritize the problem, okay? So the problem is, like example I can give you, okay? The chronic illness, okay, when the patient is attended, we used to teach the patient, this is your condition, these are the treatment that you are education from the healthcare worker, either from the nurses or the doctor. This is of your patient. This is the treatment modalities. Okay, he is treating doctors. This is the diagnosis. The patient prognosis is
Ma'am,
what?
ma'am,
Yeah.
ma'am, we cannot hear you
Why is not?
properly. We can hear sound of wind while you're talking.
Yeah.
Ma'am, not properly.
Yes, ma'am.
Okay. Still, it's not audible.
Ma'am, it was audible, but then there was wind
Like this.
sound coming like along with your voice.
Okay. Pinky, is it clear now? A little better.
Yes, ma'am. Yes, ma'am. It's clear now.
Okay. So now, okay, planning to health education, the first point is assessment, like we do in nursing assessment, okay? In assessment, what are the things that we have to do? We have to identify the problems by gathering data. First thing is we have to select the area to be assessed. We have to gather data with observation, interviews, review of literature, and after this, we have to sort, list it, and categorize the data. We have to validate it and cluster the problems. And after this, we have to diagnose, okay, nursing diagnosis. And the second, your second plan is planning. Okay, first thing assessment, and you will come to the planning of health education. Okay, so in planning there are many steps, like prioritizing the learning needs. Okay, I can give you one example. When the patient is admitted to the ward, okay, he has been getting patient education. Okay, these are the list of the medication that you are getting, this is your treating doctors, and then this is your prognosis. Even the patient can then go the same education either from the doctors or from the nurses. Okay, so we have to prioritize. Okay, so but when this is contrast when it comes to the OPD. Okay, so OPD patient, the doctors will give you so many advice and instruction. Even the doctors, they will give so many instruction and advices, and we are going to interpret them, but in just one go they won't understand, because they are in OPD patient. The one who are in inpatient, they have admitted for so long, is like little easy for them to understand, because they have been getting this. Okay, so we have to like, this is the example. What I meant is, you have to assess the area where you can give education. Okay, so it will be of great help and values when you give health education where in the OPD patients. Okay, about the doctors advices that they used to give. Okay, about the full form, about the BD, about the TID, just an example. Okay, so you have to see for the area where the patient needs it. Okay, so when you give a patient health education on OPD patient, where this is the kind of instruction that they have been given, okay, on self-care and prevention. I'm just giving you an example. Also, what I meant to say is, you have to prioritize the learning needs. Okay, so second point of the planning is negotiating the goals between the nurse and patient family. Okay, it's our responsibility to let the patient family understand that we are going to take them and health education, and then they should be willing to participate in that. All right, and then the learning contract. Tool to formalize the agreement between a nurse and patient states the learning behavior, responsibilities of educators and learners, and methods of follow-up. Okay, so the learning contract. Okay, this is an acceptance between the learner and the one who is giving it is health education, and that is our educators. Okay, we have to set goals and objective. Okay, when we give a health education, we don't just proceed, right? We have set some goals. What will be the general specific objective? Suppose let's say general objective. At the end of this, the health education, at the end of this topic, at the end of this class, the student, no, the patient and the family, okay, or the group or the community will be able to understand, or will be able to explain about hypertension. Okay, we'll be able to understand the care of hypertension. But you have to set certain objectives and goals. Okay, this is how you will proceed with your health education. Teaching and learning activities. What kind of activities that you are going to follow? It may be either lecturer, it may be either demonstration, it may be either come discussion. Okay, so these are the things. Okay, so now we have done this planning. Okay, the first thing in planning is assessment, and second step is planning. In assessment, we have to look out for the area, gather problems, okay, gather the information, okay, and then in planning, we have to prioritize the health needs, okay, communicating with the patients and the family and the community about the goals, objectives, and then you have to proceed with the health education. So these are some of the plannings of the health education. So now coming to the next topic, communicating health messages, okay. So when we communicate these health messages, we need mass media, okay, we need some mass media, okay. Let's see what are this, okay. Mass communication occurs when the small numbers of people send messages to a large group. All right, so mass communication is a process in which a professional communicator uses media to disseminate, that is to distribute the message widely, rapidly, and continuously. So mass media has the ability to reach a large number of population. It can be of any type of broadcast, printed, or electronic communication medium that is sent to population. Now you tell me, give me some example of mass media. So name, like list me some mass media example. What are the types of mass media? What audiovisual aids that we use when we say about this mass media? Your television, your radio,
News channels, newspapers.
yeah, newspapers, journals. So these are all the mass media. Okay, so this will come in the later part. Okay, so now we have to deal, okay, to whom we are going to give this health education. Okay, we can give this health education to the individual, we can give this health education to the group also, we can give this health education to the community also. All right, so let's see. So individual approach, okay. So we should, how do we approach this individual? We have to give this health education to the individual patient or individual person. We should have this personal contact or face-to-face discussion. Okay, it can be either personal contact and face-to-face discussion. Okay, so why are we doing this individual approach? Okay, to understand the client's attitude, okay, and then to clear their doubts, okay, because obviously they will have so many doubts once they get admitted in the hospital. Why are they giving this treatment? What is this? And then what is this myth? Okay, any conception, misconception, or myths about their health, about the drugs, okay, and then we have to correct. It's our responsibility giving this health education, and we have to correct this misconception and the myths that they have, and then we have to identify and remove the barriers in the way of adapting the health practices. Okay, this is the individual approach. Okay, personal contact, face-to-face discussion. And now coming to the individual approach, so it can be either personal contact, it can be either, we can either do home visit, or we can either do these personal letters. Okay, so what are the steps to individual approach? Okay, we should plan for visit. It can be either personal contact, it can be either home visit, or we can either do these personal letters also. And we have to conduct individual interview. Okay, we have to do this reinforcement, and then we have to do follow-up. Okay, so now group with the health education. Now we are going to give this health education in a group, okay, with the size of 20 to 25 members, okay, and then the members of the group are helped to think, is discussed, to decide and follow up their decision by action. Okay, so now what are the method that we can use in group health education? Okay, lecture method. We can either use this lecture method where the educator will keep on teachings about these things. Okay, and then group discussion. Okay, it will be either we'll take opinion from our side also, from the patient side, from the group side. Okay, demonstration where we can do some demonstration, where we can do panel discussion. Okay, we'll give a topic and then we'll make some group from the group, and they are going to discuss whether this is correct or not, and then they are going to share their own opinions and their views. Okay, symposium, workshop, it can be either role play, it can be either skit, it can be either conferences, it can be either field trip. Okay, these are the methods which we can do in group health education. Okay, so now coming to the health education in community, it is meant for a defined community. Okay, why are we doing this health education in a community? To create awareness to the people, okay, to help people understand that their problems, what are their problems and what is their need, okay, and to find alternative solution, okay, and then to implement them, and then we should evaluate them, and then we should get feedback whether they are implementing what we have taught to them or not. Okay, so health education in community requires local leaders who are influential and have people support, like sarpanch, okay, your school teachers maybe. Okay, so we need support from them. Okay, if we have to do a health education in community, because it is a large group of people. Okay, So who will be the one to whom we are going to give this health education? That is your target population. Although the intervention strategy is community based, okay, intervention targets specific population and includes specific population, assessing shared risk behaviors and making education plan. Okay, we have to make out the target population. Although this is meant for community, in community there are healthy individuals, okay, there are sick individuals, there are elderly people, okay, there are aged people, okay. So we have to find out who are at the risks, okay, who are at the risks, okay. So we have to make an education plan accordingly and make a specific population out of this target population. The target is community, but you have to make a specific risks, okay, specific population out of those target population. It can be either women, it can be either pregnant women, it can be either elderly aged woman, it can be either child, okay. So now the types of media, okay, there are mainly 4 types of the media that we use to communicate these health messages, okay. Health messages can be communicated to the large group of population with 4 types of media, okay. The audio visual broadcast media, the audio visual non-broadcast media, print media, and electronic media. So when I say audio visual broadcast media, it is your news program example, okay. It is your the news program which is coming up in television and radio, your documentaries, movies or films, education, entertainment, okay, like your tweets, public services announcement, okay. So when we have these immunization schedules, okay, Amitabh Bachchan and on your celebrity, they used to do this advertisement like public announcement, okay, to aware the people, to grab the attention of them. So this is your audio visual broadcast media, okay. Example, your news program, documentaries, and then public services announcement, which is being given off by the radio and television. Coming to the next types of media, that is audiovisual non-broadcast media. Self packages, documents, maybe cartoon or a short features, okay. It's the examples are your videos, your DVD, your CDs, cassettes, and tabs, okay. So print medias are your newspaper, magazine, leaflet, pamphlets, booklet, journal, photo comics, and billboard that you guys have been doing. And the electronic media, it's your website, okay, your information packages or your text messages, mobile phones, your computers, okay. These are all the examples of electronic media. So now, so what are the common messages? So the common mass media used in health messages, okay. Example, I have told you already, your television or radio and video, okay. So this is television and video, they are the most commonly used mass media. So we rely on this, okay, mechanism. And then TV has found to be have some positive impact in health promotion, and it's also enhanced health belief, okay. Do you agree to this point? Television has found a positive impact in health promotion, okay, and has enhanced health belief, okay. When we do not even have this so many channels, when we were in class like 2-3, like our old grandmom, and that they used to listen to this television program, okay. They used to have so many advertisements, so many health messages on health. If you keep on doing this, there will be this. If you, this is the health promotion method you can follow. So that is why TV has some positive effect in health promotion, and I agree to this point also. So video program also proved to be among the most successful strategies to improve communication. So please connect me for 10 more minutes. Again, I will try to end this topic, okay? The meeting is about to end in just a minute, so I will make a new link, okay? I will share the link to all of you.
Okay, ma'am.